Oxfordshire in England is set to join a growing list of regions across Europe to go smoke-free. The county wants to ban smoking outside restaurants and offices by 2025. The French city of Strasbourg has also expressed a desire to make its university campuses smoke-free. And in Italy, Milan has prohibited smokers from lighting up outdoors within 10 metres of another person. Well, here to hash out the pros and the cons of smoke-free areas are Dr Yach, president of the Foundation for a Smoke-Free World in Southport, Connecticut, in the United States, of course. And joining us too is Simon Clark. He's a director of Forest, a pro-smoking organisation. He comes from Cambridge in the UK. Well, thanks, gentlemen, for joining us here on the programme. Let me start with you, Dr Yach. We know that, of course, smoking is harmful, but why are you calling for this ban?
Well, first of all, I'm commenting on the ban. I'm not calling for the ban. I think that provided it's done in a way in which the most crowded parts of restaurants that have simply moved from indoors to outdoors apply what was being done in the indoor environment, that makes sense for the same reason that we ban smoking in indoor restaurants. But doing it much beyond that and in very uncrowded areas is not something that I'd support.
Okay. Let me turn to you now, Simon Clark, of course, Director of Forest. You are calling for, unless I'm mistaken, people to be able to smoke freely when they want. Why are you opposed to these measures?
No, we certainly wouldn't argue that people should be allowed to smoke when and where they want. Clearly, there need to be restrictions on smoking, and at the moment, we have massive restrictions. People can't smoke anywhere in any indoor public place in many, many countries throughout the world. They can, at the moment, smoke outdoors, and smoking outdoors is not a public health issue because there is absolutely no threat to the health of any non-smoker if somebody lights a cigarette in the open air. And when it comes to smoking outside restaurants, that's the only place that people can actually smoke at the moment. If you're a non-smoker and you don't want to be exposed to any tobacco, you can sit inside. Some restaurants have smoking and non-smoking areas outside, which seems to us to be a good compromise. But ultimately, it has to be up to the restaurateur. He knows his customers best. It's not a public health issue. It's all about getting as many customers in as possible. And we've seen how the hospitality industry has been devastated by the pandemic. They need all the help they can get. They don't need more regulations designed to drive more customers away.
Dr Yach, let me turn to you. Does that sound reasonable?
Well, I think we're missing the real point of doing this, Tox. I really think if the goal is to try and help smokers, particularly adult smokers, quit or reduce their risks, we should think about how we could do it in ways that are empathetic, particularly to the many smokers who may have mental health conditions or feel stigmatized anyway, and are not going to stop their smoking habit by simply having the environment around them closed down. What would help is to step up what the Royal College of Physicians said, the efforts to invest in better cessation and access to harm reduction products at a level that the UK is actually starting to lead worldwide. If we reached out and every doctor was to use every consultation with smokers to help them quit or know that using e-cigarettes and reduced-risk products will substantially lower their risks, I think we achieve our real goal, which is to lower the death and disease caused by tobacco in society.
But what about people who are, simply enjoying a meal outside next to a table full of smokers? What about their rights?
Well, I would argue that that falls exactly into the same reason why we actually took down smoking indoors. In the post-pandemic period, we've now simply moved the risks outdoors. And if you're sitting right next to somebody, you both have the irritation and nuisance effect and the irritant effect. And in that environment, I would say it does make sense to actually not allow smoking.
What would you say to that, Simon Clark? Does that sound like an area where you would be prepared to compromise?
Well, no, because as I've said, it's not a public health issue because there's no risk to the health of a non-smoker if somebody, even outside, is smoking a cigarette next to them. It might be a slight annoyance, but we can't go around banning things all the time. Where I do agree with Dr Yach is that I do think there should be more information given to consumers about reduced-risk products so that adults who smoke can make a choice. But what a lot of anti-smoking campaigners forget is that millions of smokers do actually enjoy smoking, and there are millions of smokers who don't want to quit. They take pleasure from smoking. So this is
But
all about
what about the people
accommodating.
who are sat there enjoying a meal and they just simply don't want to smell it? Surely they've got a right to enjoy their meal and enjoy the outside without being troubled by tobacco.
Well, isn't it funny that 15 years ago we were told that smoking had to be banned indoors in order to protect the health of bar workers who were allegedly dying as a result of being exposed to second-hand smoke? Now we're told that it should be banned outside because people don't like the smell. I mean, this is utterly ridiculous. You can't ban things simply because somebody doesn't like the smell. Look,
Yeah, but
the
we
ideal
have learned
situation
so
would
much
be...
in the last 15 years, though. You must admit that.
Well, again, with great respect, I'm not sure that you're listening. Smoking outside is not a public health issue because you are not risking the health of non-smokers by lighting up outside. But in a perfect world, we would have smoking and non-smoking areas. We would have smoking and non-smoking bars and restaurants that would give people choice. And ultimately, this all comes down to choice and personal responsibility.
Sounds as if I haven't been listening. If I listen to what Simon Clarke is saying, Dr Yach, where do you stand on this finally? Do you think people should have that, be able to determine who they sit next to at a table where they want to eat?
Well, as I said, I think the fundamental question is, what are we trying to do? We're trying to make it easier for people who smoke to actually move away from a product that is killing many people in the UK and across Europe. And we know that all the efforts over the last few years introducing smoke-free public places, as well as providing cessation and harm reduction, have made a big difference. The lung cancer death rates can and should be going down faster. So should the others. That's why I see it as not just being a question of having to prove that sitting next to a smoker is going to increase your risk or not outdoors. It's going to also affect the whole attitude to whether smoking is something we should be actively trying to prevent and supporting smokers to do it more aggressively. And the best way to do that is to be far more pushy and to have the doctors step up far more in every interaction with smokers. Those who don't want to quit, well, that's their choice. But a vast majority of current smokers actually want to either reduce their risk or to quit. The problem is that we're not using the opportunity.
President of the Foundation for a Smoke-Free World. I'm afraid we have to leave it there. Simon Clarke, Director of Forest, the pro-smoking organisation there, joining us from Cambridge. A debate we'll no doubt be returning to. Thank you very much for your time.